Welcome to PodMind, where we explore the intersection of data science and mental health research, policy, and practice, and incredible people driving change in this space. PodMind is brought to you by DATAMIND, the UK's hub for mental health data science. I'm Marcos del Pozo Banos, Fair Curated Mental Health Data Co-Lead for DATAMIND and Senior Lecturer on Mental Health Data Science at Swansea University Medical School. This is our very first episode, and we are started at the beginning, as one does, by diving into the story behind DataMind, its impact so far, and its vision for the future. And there is no one better to tell us about this than Professor Anne John from Swansea University and Professor Rob Stewart from King's College London, the co-directors of DataMind. So let's get started.
Hello, both Professor Anne John and Professor Rob Stewart. Thank you for agreeing to record this. Of course, this podcast is about DataMind. So we couldn't start any other way than asking you how all of this started. So I guess going back to not even when DataMind really kicked off, but even before that, when the funding call came out, how did DataMind come to be?
I mean, I would go even before the funding call came out.
Oh, okay.
So MQ set up a mental health data science group. And actually today is the 10th anniversary of the first meeting of that group.
Mm-hmm.
And none of us really knew each other. Some people knew each other, others didn't. But it was, we wrote some joint editorials, we had some meetings in London. And then the MRC put out a call for mental health pathfinder projects. And I think they funded 10 or 11. And then they held a meeting. And we all walked into that room as like the principal investigators of those grants. And we all knew each other from the data science meeting. So then when the MRC call came out, we all got together and put in a bid together. And I think where that's ended up, so there's all the DataMind work, but now there's also the mental health platform. And we're doing things in terms of sharing data in the mental health platform that are really difficult to do. Like people are agreeing to share their data and put it in a trusted research environment from the onset. And I think that's because we all trust each other. And that's built up through, DataMind. This is the DataMind podcast. DataMind is absolutely at the heart of it. But I think it's been a sort of 10-year journey for everyone.
Oh, wow. Okay, cool.
Yes, I mean, I think it's kind of hard. You have to kind of keep remembering how small the field was when we began. It's still fairly small now in the sense that we do mostly know each other and we know what's going on with all of our groups and we know where everyone fits in. Data is quite a broad field. There was been a much longer history of what we would call psychiatric epidemiology, using the traditional cohorts but also administrative data to some extent. So that's much longer running. What we would call data science or healthcare data science is much, much more recent, and there were very few people involved in it back in the early days, which was why MQ set up the meeting, why it was a good idea, and it brought together people who were doing it in lots of different ways at the time, but relatively few groups at least compared to psychiatry academia generally in the UK. So it has been very easy to stay in contact because there haven't been that many of us. But it's nice that it's a growing field now.
And I remember back then, like I was quite a junior researcher. And so this is like pre the 10 years. I can remember someone just going to me, "Oh, you're the one in Wales, aren't you, working with primary care data?" And so I think the mental health data science field just covers so many different disciplines, isn't it? Absolutely built out of psychiatric epidemiology, but data scientists, computer scientists, AI people like you. So there was a language to build, wasn't there,
Yes.
across clinicians and, even, so Rob and I are both medical, but, the primary care perspective and the secondary care perspective is very different.
Right, so it's really cool. So it sounds like DataMind really started from the very beginning of the field, kind of, and then it almost like naturally emerged from the maturation of the field into maybe something more concrete.
I think, no, you're right. I think it has been organic, and that often isn't the case with funding calls. Often they are imposing a structure which isn't there, whereas I think this has, through successive funding calls, quite nicely developed out of the capabilities we have in the UK, which is good, and building on the strengths that everyone has.
And so what Rob says there is really true. It's also just, DataMind, it has expanded. We're in our 4th year now, as the field has expanded. So, we've got a much bigger focus on natural language processing and text in this new iteration, and, wearables, sort of ecological at the time assessments. And so, it's such a fast moving field. You've got to have the flexibility to move with it.
Right, so actually that's a nice leeway into my next question, which is, so as you said, DataMind has been going on now for 4 years, almost 5. Has it evolved? When you started, did you envision it being what it is today? Or has it been like almost like if you see yourself from like 4 or 5 years ago, would have been a surprise? It's like, oh, I didn't imagine that DataMind will become what it is today and also do what it does today.
I guess I didn't quite envisage all the other things that we would interact with. So the mission, and then the goals program, and sort of HDR UK was around but quite distant, whereas now we're much more involved with them. The sort of Population Mental Health UK RI initiative. So I guess what's growing around us, and the mental health platform, what's growing around us it's not growing around us, but we're sort of at the centre of many of these things from a data perspective. That landscape has transformed, hasn't it?
Yes, I think it's a yes and no answer. So I think, as Anne says, the landscape has transformed in what might be not completely predictable ways if we were going back. On the other hand, I think DataMind has evolved in some ways as predicted, because the way DataMind is now, a lot of what we were calling initial road builder projects are now full sort of themes. And what began as kind of sort of smaller scale things have now moved into larger scale things. So I think that validates the approach we originally had 4 or whenever it is years ago, in the sense that they are now maturing and moving forward in the way that we'd hoped. So in some ways that's a predictable thing. But yes, we've had to adapt to the funding environment around DataMind.
And I think, another yes and no would be the lived experience at the centre of DataMind. So, we very much hoped, we absolutely wanted people with lived experience at the centre of everything. We had a huge focus on people with lived experience and industry partnerships and trying to resolve some of those issues. But I think they have exceeded my expectation in the things that they've done. And things like the glossary, which is there to improve communication. Those aren't things that we realise that we produce, and then, we've had so many different initiatives like the UK LLC come to us and go, can we do the same, or can we develop a set of terms to put in the glossary? And then, the members, we call it our SRAG, but it's People with Lived Experience Advisory Group. I think they've both transformed the research and the data that we've been doing, but also they've transformed. They've written editorials, and you know, a number of them are involved in loads of different initiatives, some nothing to do with DataMind. So I think that's one aspect that's absolutely exceeded. I feel really proud that, and that's down to the people themselves, and then Linda and Naomi, who are the coordinators.
Great. It's as we said earlier, it's been already for almost 5 years. What has been perhaps the most challenging thing? Because we are, you know, DataMind is big. There is a lot of people involved. I imagine coordination must be one of them. But is there anything in particular that comes to mind, like in terms of like what has been the most challenging thing that you have had to?
Well, you can maybe answer about the coordination, because it lands more on Swansea than it does on King's. I think from my point of view, I think bringing the strands of DataMind together, and I think also the interactions with external funding environments where we're there, and it's very nice that we're talked about as a kind of resource for the country, but other funds have, you know, they can sort of divert priorities, they can sort of mean that you're running in a particular direction, that because of that external environment wanting to kind of keep focusing on core initiatives and make sure that the sort of core delivers. It can be distracting. I think it's generally been good. But it's a challenge to try to keep a vision whilst also being responsive. Mm-hmm. I suppose it's both having a kind of consistency but a flexibility. I'd say trying to kind of get the balance right between those. We don't always get it right, but I think we largely have in the longer term.
Right.
So the challenge of coordination is there. I think the relationships and trust between everyone makes that easier. The thing that truly makes it easier is the excellent coordination team that's based at Swansea. So Dara, Katie and Nick, you know, who have absolutely, you know, Nicola McLean is our comms and engagements lead, and she's done lots of great comms and engagement and developed the website and everything, but she's also developed really close working relationships with people with lived experience, with some of the researchers. So I guess it's not been as horrific as it could have been at all. I think there's a lot of value in the fact that we continue to expand, but we sort of responded to that sort of bringing everyone together. We have those whole team meetings virtually and much more regularly than we used to. So I think it's improved actually as time has gone on. And then for me, another challenge is I guess it's less coordination and more cohesion, so that you know you're keeping people on that sort of DataMind pathway, but still with the freedom to be following all the things that they're doing in their own work, and like holding that together, isn't it?
I think something worth mentioning is that DataMind is par excellence a post-COVID network, and it's a network that might not have been possible to run in the way that we have pre-COVID, meaning in the days when meetings were much more physical and it was very difficult to have joint video calls or phone calls or anything, and it was kind of very difficult to do. So it in some ways exemplifies what may well be the future for these networks, in the sense that you can keep them functional because of what we can now do across a country and keep together and keep in communication in a way that was very difficult before, and which is vital for a network that is quite thinly spread, as it were. It's got a lot of sites, and no site has huge amounts of resource, so you do rely a lot on people's goodwill of keeping together. But again, those networks, that sort of network only works in that way when people know each other, which is why the kind of physical meetings are important, because people can properly catch up. So it's again, that's a kind of balancing act that a lot of places are having to do post-COVID, that in some ways you can enable a lot of these sort of things. And the mental health platforms are similar in the sense it can be distributed across sites all around the UK and still work. And DataMind has worked in that respect. But you do need to kind of balance that with the need to periodically meet physically to have those kind of in-depth discussions that might not be possible otherwise.
Because we started in 2021, the first grant was in 2021,
Yeah.
so Rob's completely right. I'm not sure such a large network you could have held together in the same way.
No, I don't think so.
The future, what is awaiting to DataMind in the next 5 years?
So I think one of the important things that we need to do in the next 5 years is really foster, but also foster the opportunities for the next tranche of leaders. You know, so I think it's really, you know, as Rob said at the beginning about how there wasn't a lot of capacity, and as well there wasn't a lot of funding, and that has improved. It's still not equivalent to cardiovascular disease or cancer, but it's improved. But what that highlights is the gap in people who can lead. So I think one of the big things that we need to do in this grant is create that new sort of guard of leaders in mental health data science. And I think that should be one of our big focuses.
I agree entirely. I would also add, I think sort of achieving impact is important, making a difference. I think continuing to respond to what might well be a very rapidly changing healthcare environment. At some point, but I think the difficulty is knowing the timing of it, at some point the healthcare system will be completely coordinated, joined up. It's impossible to envisage that it won't be with electronic records. It's just could take a long time, so it may be within 5 years that happens, in which case our role is to make sure mental health is in there and make sure DataMind is making sure that mental health is in there, because otherwise, as always happens, the rest of healthcare will go its own direction and mental health care will get sidelined. So we have to just make sure that mental health remains a kind of central part of that. And I think we can do things in the next 5 years that are completely innovative, that completely couldn't be done otherwise, possibly that couldn't be done in any other country in the world apart from the UK. I think we can innovate, and you then hope that that's picked up and those innovations carried forward, and that we've made a difference to whatever the healthcare system is further down the line.
And you know, as we were talking about that, to me what we've just described is our vision about improving lives, and then our aims, our objectives.
Yeah.
You know, so I think, so although it may not always feel like it because we're such a large network, we do have a path that we're following.
So I would like to finish with one question, which is, we have, you have mentioned a couple of times about the fact that we need to, DataMind has to be flexible and adapt to, the realities of the funding environment. So as a bit of maybe a fun question, imagine that DataMind is not restricted by that, so it has infinite large pockets of money. What would you do with that money? What would DataMind do?
I would invest in early career researchers. I think build capacity with it. I think what DataMind is an infrastructure, and most of its funding isn't to do research, but if we had more funds, the more research that is done using the infrastructure, the better the infrastructure becomes. And in some ways it's good that you have to be competitive about it, because it means that ideas keep sort of being as good as they can be to get through the competition. But even so, I think there needs to be more investment in people who use these infrastructures and getting funding, which is about capacity building, because it's early career researchers that have the time and the energy to push things forward, and then the infrastructure will evolve faster. So that would be an obvious win.
So I completely agree with that. I think there's investment in early career researchers, investment in people with lived experience. You know, I think we could do a lot more investment in developing and growing that network. And then investment in that infrastructure and the governance around it, and then ensuring that we dovetail with physical health. You know, and I think that will require investment, because at the moment, you know, there are things like making, you know, mental health hospitals fully electronic across the country. You know, ensuring that that data is of good quality. You know, I still think there's infrastructure to invest in. So I know that we've had conversations with various trusts where we would love to have put in money so that they can essentially be computerized, and that we can look at, you know, prescribing and secondary mental health care services. You know, we know there are systems you can use. Rob's sat next to me. But I just think to bring the whole country up together.
Cool. Thank you both, Anne and Rob. Thank you for recording this, and yeah, we'll see you in the next one.
Thank you.